PT Central, or Physical Therapy Central, a proud member of the Newcastle Chamber. We're here with Rayanne Thomas and Gayla Riddle. We're really happy to be here on this Friday afternoon, having a great day. It's my birthday, by the way.
Oh, happy birthday!
Thank you. A great place to be for my birthday. So we're really happy to be here. Physical Therapy Central has been a member of the Newcastle Chamber from the beginning of your business. You said here 15 years. So thankful for all you do. You're also a board member. We appreciate all that you've done for the Chamber. But we're here to talk today about your business, to highlight your business, all the things that you do. So I'm going to let you talk about your business for a little bit, and then we'll go over some very specific things that are breaking ground in the field and things that you guys are bringing to the Newcastle community. So
absolutely. Thanks, you guys. So we have been part of the Newcastle community since 2005. And Physical Therapy Central is a privately owned outpatient physical therapy clinic. So it is owned and operated by physical therapists, many of which that are actually from this community that went to high school here, graduated from high school and went on to get their physical therapy degree and came back, which has been great. Our primary focus is really on orthopedics. So we focus on anything from preoperative to postoperative care. So things like ACL treatments, knee replacements, spine surgery. But also a lot of times what people don't know is that you don't have to have had surgery to come to physical therapy. So we treat a lot of things like people are like, man, my neck hurts. And so anything that is limiting you from doing the things that you want to do, playing with your grandkids or playing a sport or running, we treat it.
Yeah. You've told me something in the past that I'll have you maybe explain it, is how you don't need to be referred to a physical therapist now. Is that true?
That is true. So a couple of years ago, our profession fought really hard to get patients like you and others that are having pain better access to physical therapy. So historically, in order for your insurance to cover it, you did have to have a prescription from your physician. And now, if you kind of tweak your low back or sprain your ankle a little bit, and you know that you don't need any imaging or anything like that, you can come to us directly. Obviously, we screen you for those things so that if you need that, we refer you on. With Medicare, you do still need a referral, but with other and private insurances, you're good to go.
That's terrific. Thanks so much. We would love to hear about some new technologies or new things that are unique maybe to this place. So we're going to move around the room if that's okay. Maybe show us a few things.
Yeah, I'd love to. Okay, so one unique form of treatment that we have here at Physical Therapy Central that a lot of people don't know about and is relatively new in the physical therapy industry is called trigger point dry needling. Phil has so graciously volunteered to give a demonstration. So oftentimes when you do work on a computer for hours on end or a roller or whatever, you can get tennis elbow or any sort of tendonitis in the forearm. This treatment is actually used for all areas of the body, but we're going to demonstrate it today with Phil. You ready?
Yes, I am.
So you're just going to feel, all I'm looking for here is a point in the muscle where there's a little more thickness, and I'm going to identify that spot. Typically we do some deep tissue work to work that out, but the dry needle allows us to get in there deeper and be more effective. So I'm going to find that spot. I'm going to give you a little stick. Right into the muscle. We hang out in there for about 5 seconds or so to release that and improve blood flow, and then we're out. Usually about 4 or 5 sticks in various regions depending on where you're hurting, but that's it.
It didn't even feel it.
Yeah.
So you're good.
Yeah.
You're good.
Yeah, good. Sometimes Phil's not having a lot of pain in this area, it sounded like. So sometimes patients don't feel it and it's not painful. Sometimes if you are hurting there, it'll feel like a deep ache. But usually people get a very quick response of decreased pain. Yeah.
Thank you.
Yeah.
I appreciate it.
Okay, so one of the newest and most cutting-edge treatments that we have here at Physical Therapy Central, and we've adopted these at all of our 28 locations across the state, is virtual reality as an adjunct to physical therapy to treat people who have been experiencing pain. And what we know as physical therapists is that for a long time there's been a component missing to our treatments, and that is the real understanding behind pain. It's not just that you have a painful stimulus that goes to your brain and then it comes back down and you feel pain. That's our old understanding of pain. What we know now is that it's a lot more complex. There's a lot of factors that play into people who have had chronic pain, such as depression, becoming easily distracted, fear, and all of those things, and really difficulty relaxing. So that component that we've been missing in PT, we've now brought to Physical Therapy Central. So what we love about this is that there are ways to control your breathing through mindfulness and emotional regulation. And there are strategies that once a patient understands what we understand about pain, and what the VR goggles do is they explain that in a very easy way to understand. Once the patient has that understanding and has some tools that are taught through the VR goggles on how to control their breathing, control their relaxation, and thus have a bit more control over their pain, we see a lot faster and a lot better progress with our other treatments in physical therapy.
Okay, I'm here with Emily Littlejohn. When I walked in the room, this caught my eye, and I would love for you to tell me what this is and what it can do for your patients.
Yeah, this is our Ultra G, or also known as our anti-gravity treadmill. It's really nice. We use it with a variety of patients, all the way from our athletes up to patients that maybe had a joint replacement. With this machine, we can unweight up to 80% of your body weight, which is really nice if you're kind of relearning to walk, or can't put full weight down because, say, you fractured your ankle or something like that. With our athletes, we like to use it to help with their recovery after an ACL injury. They can start running in it a little sooner, and it's in a controlled environment, so you can work on their cardio endurance and kind of build that back up as well. And then it's really nice for our total joints that if you just had surgery, you can't get in the pool to walk in an unweighted environment. We can get you in this the day after surgery and kind of watch you walk and help correct your gait mechanics and make sure that you're doing the things you need to do to walk without pain.
What we know is that if you access a physical therapist quickly after sustaining an injury like low back pain or neck pain, that you can really avoid costly procedures like surgeries and MRIs. So the evidence tells us that as soon as you begin hurting, or if you do have an ache or pain that has lasted over time, access a physical therapist first and try conservative management before more costly and invasive procedures are needed.
We had a great time here today. Thank you so much, Rand, Emily, for showing us all the things that you offer your patients and our community of Newcastle. Thanks for all you do for the Chamber. We greatly appreciate it. We love going out and visiting our local businesses and all that you do. And have a great day. Thank you.